Hi there, everybody. Hello. This afternoon, we're really excited for the conversation we're just about to start. My name is Lori Kelly, and I serve as the Chief Philanthropy Officer at Providence. And we want to thank you for joining us today for this discussion about what Providence is doing in and for our communities through our Community Partnership Division. We want to talk to you about how everyone can really help during this pandemic. As a reminder, this information is provided during this event is for information purposes only. If you have any questions around the COVID-19 pandemic, please visit our website at providence.org or visit the cdc.org for their official medical updates. This event does not create a doctor-patient relationship, and any questions or medical items discussed are not considered guidance on what you should do. For any medical questions, please reach out to your healthcare professional or your primary care provider. Now let's begin. So today we have a bit of a different discussion, and I'm really excited to introduce you today to Dr. Dora Barilla. Dr. Barilla is the Group Vice President for Community Health Investment at Providence. And also with us today is Tim Zarichny. And Tim serves as Executive Director for Supportive Housing at Providence. And both of them work in the Community Health Investment Division. And I can't think of a better place to work right now than in community investing in our community health. So really excited to start with a question for Dora. So Dora, can you please tell us more about the Community Partnerships Division, specifically the work you do with this group in your area in community health investment?
Certainly, Lori, and thank you so much for having us and really for highlighting this important issue to really talk about those in our community that are vulnerable and that are disproportionately impacted by COVID-19. So thank you. The Community Partnerships Division really is a group of many different departments. And we're really looking at a more of a holistic way of leaning into our communities. So philanthropy in terms of how we're raising dollars for our communities, as well as looking at how we're using our voice. So our government affairs team and really leveraging and using our voice for our communities, whether we're in a small community or at the national level for some federal issues, as well as really looking at how we're investing in our communities responsibly and assessing the health of our communities. So that's really my division, looking at what we call community health investment. And what my role is to begin to look at how we assess the health of our communities with a strong focus on looking at health inequities, because you don't improve overall health if you're not addressing the health inequities that exist in our communities. And then really identifying what are the most strategic investments and identifying who are the partners that you need to work with in order to improve overall health, which really is core to our overall strategy of health for a better world. So it's really a privilege to be a part of this. And a part of community health investment is really looking at how we partner with other divisions within Providence. And we're really fortunate to have Tim as a partner in our supportive housing, for us to begin to look at some of the homeless issues and housing instability that we've identified through our community health needs assessments.
That's great. Great. Thank you so much for that overview. And Tim, that just leads right into your area. What is supportive housing? And talk about how Providence plays a role in that in the communities that we serve.
Sure. Thank you, Lori. Providence Supportive Housing is comprised of 16 permanent affordable housing programs in Washington, Oregon, and California. We have currently about 780 units of housing, and currently our census is around 905 residents. We focus our housing on service to low-income seniors and people with disabilities aged 18 and older.
Okay, great. And how many of the communities do we have these facilities?
Oh, goodness. We're spread across Washington, Western Washington, Portland Metro, and in Oakland, California.
Great. Yeah. I think I always want to remind people of the breadth of Providence. We're in 7 states now with 51 hospitals and 1,100 clinics, and now finding out about supportive housing. So just so many things going on to fulfill our vision of health for a better world. And so Dora, the COVID-19 pandemic has just hit this community and our world in so many ways, but how has it really impacted those most vulnerable, and what's been our response here at Providence?
Yeah, a really important question, and one we really need to think thoughtfully about, that it really has put a magnifying glass on those inequities that already have existed. They're not new, but really they're amplified. And unfortunately, certain populations face differential exposure and exponential implications because of that. And so, as a part of our routine in each one of our 51 communities around our 7-state footprint, we do community health needs assessment, and we identify which parts of the community are more vulnerable. And so we've already had that assessment. We've already identified a lot of our partners, and so we have existing relationships. And so really when COVID-19 hit, we knew that there were going to be certain communities that were disproportionately impacted. We see that in any disaster throughout our nation's history, and no different than COVID-19. And so one of the things that we have is through our community health needs assessment, core to our mission is serving those who are poor and vulnerable. So if you see in the slide that we have is that we've identified where we have existing COVID-19 occurrences and cases, and we overlaid that with something that we call the Social Vulnerability Index. And the Social Vulnerability Index is really an indicator that's used by the CDC in response to disasters, that is comprised of about 15 different indicators, including overcrowded housing, looking at poverty, as well as whether or not people have access to transportation, and really began to look at where are those communities. And we knew that we had already been working on a housing instability and homelessness initiative in our health system. And we knew that they were going to be disproportionately impacted. And so that was one of our first responses, was to really begin to reach out to our partners in the community. And, I think an immediate response was to make sure that they had shelter. As if you look at, how are those that are experiencing homelessness able to wash their hands? How are they able to have safe social distancing? So really working with our partners to what we've called either quarantine sites or alternative sites of care for those that are vulnerable to exposure to COVID-19, perhaps those that are, in COVID positive, but not yet needing hospitalization. And then obviously within our hospital, addressing those that, are COVID positive and needing hospitalization. But our role really in the community is to begin to look at how we're partnering with, those organizations. So providing them cash donations, really working with them. They also need PPE. So in addition to our shortage, just really helping to make sure that all of the providers that were in the community are actually appropriately protected as well as food, just basic needs. So not only those that are experiencing homelessness, but a lot of our vulnerable communities didn't have access to food. When all of the hoarding came on, many people that didn't have access to transportation would go to the stores and there would be nothing on the shelves. Right. We would have, mothers and babies that went to the store and couldn't get formula. It wasn't that not only did they not have money, but there was nothing left on the shelf. And so what we did was really mobilize our community partners, identified who was in need, and really began to partner with them and resource them through whether it was investing in food banks, providing what was necessary at some of the quarantine sites, and really looking at developing community response funds so that we're leveraging a lot of the dollars that are being invested in our communities so that we can address not only what's happening today, but some of the long-term and lasting impacts of COVID-19.
Exactly. Yeah, on calls with Dora's team, I just cannot imagine the number of hands in all this work. There's just so many people on her team and in the communities that are working hand in hand across all these 7 states to get some of these issues resolved. So it's pretty inspirational, I have to say, pretty humbling. Tim, for you, can you help us understand why people experiencing homelessness are considered a COVID high risk group? She talked a minute ago about it's hard to even wash your hands, but what are some of the other things that they're experiencing?
There's a Gosh, there's a million ways to approach this question. I'll start with the idea that we began with a concept 3 weeks ago, 4 weeks ago in Northern California, this notion of sheltering in place, to stay at home.
Right.
That's the direction that we all received. That's how the public health community is prescribing that the public can stay safe,
Right.
that we are safest within the confines of our homes, right? So how does that work for somebody who doesn't have a home, or for someone whose home is a dangerous place to be? Let's say it's the site of repeated episodes of domestic violence. What happens then, and where do they go when we recognize that all these public resources are shutting down? Business as usual is no longer business as usual. Where do they go? What do they do? We already know that people who are homeless, people who are experiencing homelessness, they have a higher disproportionate number of folks who are disabled, who have chronic physical conditions, mental health challenges, behavioral health challenges, social challenges, and those challenges are only exacerbated by the presence of a pandemic. Not to mention that these folks are all, they tend to cluster naturally for safety. And it's in those clusters that transmission is far more likely. So we as a society who've enabled homelessness to become what it is, have also enabled this vector of transmission to be as likely and as lively as it is.
Wow, great. Well, a lot of issues there. I know you were talking about earlier, even before we got on this, just some of the risk factors that people have going into becoming homeless and that.
Yeah. Can I make another point, Lori?
Yeah, of course. Yeah.
There's a misnomer floating around out there, and since I'm on the record, I'd love to take an opportunity to approach that differently. COVID-19 is being portrayed as explicitly and exactly as it's being called the great equalizer.
Yeah.
And in some respects, that's true. I understand where that's coming from. Any individual could contract COVID-19. But in the end, what we'll find out when this is all behind us is that COVID-19 disproportionately impacted poor communities, people of color, the elderly, the uninsured, and the homeless.
Yep.
So we have to resist this notion of COVID-19 as the great equalizer. It's not. When the story of this pandemic is ultimately written, it's these vulnerable communities who are going to take the hardest hit.
Yep.
Point well made. Thank you. Thank you for sharing that. And you're on the record. Yeah, you are. Dora, you were talking earlier too before this, you're based in the LA area. I'm here in Oregon. We've got a lot of services in Alaska, Seattle. We're down in Texas. We're in 7 states. What do you see the differences between the regions, and what are the similarities that we're seeing?
Yeah, thank you for that question, Lori. Because even though there's so much diversity in our geography, there's a lot of commonalities, and I think some of the similarities, as Tim mentioned, are those vulnerable communities, those poorer communities, are disproportionately impacted. So just seeing the lack of food to those, whether they're seniors that are, not able to get out and have access. So we're seeing that everywhere. A lack of PPE in some of the community organizations that are treating, vulnerable communities are, we're definitely seeing that, as well as just a lot of fear. Unfortunately, we're seeing, an increase in racism and stigmatism, especially amongst some of the Asian and Asian American communities, which, is really devastating because we know of the consequences of that as well. But in terms of, some differences, if, we have a slide of what we call our point in time count. And this is really looking at data from 2019 around those experiencing homelessness in all of our communities. And you can see that, there's some of the highest numbers are up in Washington, in King County, as well as in Los Angeles. So, I think those were two of the hardest hit communities in terms of COVID. And you're seeing, some pretty significant, numbers, in terms of confirmed cases in both of those counties. And so, we've seen a lot of mobilization around, just like Tim mentioned earlier, how do we ensure that all of these individuals, our dear neighbors, have appropriate shelter, that they're safe in this time where we're asking people to shelter in place. So a lot of partnerships with a lot of our departments of public health and our counties to really begin to look at alternative sites, and then to begin to look at how are we providing care in those alternative sites. So up in King County, you'll look at what they call treatment and assessment centers, where they were housing and being able to treat. I think, some commonalities were desperate need of infrared thermometers as well as masks, to protect and screen a lot of the residents in those shelters. And then in Los Angeles, I live here in Southern California, and to watch the mobilization of communities to begin to find emergency shelters and these alternative quarantine sites has really been overwhelming. I think the stigmatism of, not in my backyard, that, we have people that are fearful of having those experiencing homelessness in a motel or a hotel near their communities. And, a lot of fear, a lot of stigmatism. And so I think, those are some differences and some commonalities, but I think, we are seeing, one thing that we're seeing across every single one of our communities is an absolute willingness to roll up our sleeves, partner with our communities, and do what needs to be done. The amount of innovation that has happened with, just repurposing a lot of our mobile medical vans, getting them out there in Los Angeles and up in King County to begin to screen and provide those resources, offering, some of our community benefit dollars for surge capacity in some of our regions, like in Los Angeles. Just even our own caregivers up in the high desert, where they didn't have, in Southern California, where they didn't have infrastructure with communities, providing cash donations to food banks, and our own caregivers driving the food to seniors that are shut in. So, I think this overwhelming call, you see that in our caregivers to the need in our communities, is inspiring.
Yeah. And one thing for those that might be watching that don't work at Providence, we call everyone that works at Providence a caregiver. So if you've got an office job, you're a caregiver. If you're a doctor, you're a caregiver. So our employees have just been stepping up all over the place. It's been absolutely just amazing to see the daily updates that we all get. It's very enlightening and very empowering. So we're really blessed by a lot of the folks that work here. And Tim, for you, what do you think Providence will do with this after the fact? As we're responding to the crisis, but then after, as we move forward, what do you see as some of the things that we might be talking about? Maybe we're not there yet because we're just handling this crisis right now. But what are the learnings? As Dora just said, we're, in the last 6 weeks, we've probably gotten more done than we would have gotten done in 2 years if this hadn't have happened. So how do we take that? And what will Providence's role be, you think, in the housing piece?
There was a stunning op-ed in the New York Times this morning. I don't work for the New York Times. I stand to gain nothing here. But I want to quote a sentence from that op-ed this morning because I think it speaks to this question, Lori. The sentence is, "The inequalities of wealth have become the inequalities of health." So when we look at the root causes of housing instability and homelessness, I think Providence and I think all healthcare providers.
Oops, did we lose Tim?
Uh-oh.
I think we might have
lost Tim.
We'll have Tim come back in a second and continue with that. Dora, just for you, what do you think moving forward? How can we seize upon this moment of all these people, and what community partners are really, are we really working with right now that are, you just see this is really a unique relationship that we're really going to be able to leverage moving forward. How will we keep this sense of urgency up?
Absolutely. And I think, we thought about this a lot in terms of how do we take what we call these disruptive moments and galvanize and, transfer them into generative moments so that we can say all of this energy of just crisis. How do we translate that into longer term solutions for, rebuilding the fabric of our communities with more of an equity lens? If we don't do that, it will be an absolute shame. So in terms of, as we think about our rebuild and we think about the long-term recovery, Lori, that this isn't, regardless of, I know everyone has their estimates in terms of when the cases will begin to flatten out. But we need to remember that this isn't going to be finished with just the health implications, that there's going to be multiple waves of what's happening with this COVID crisis, that, after, we address the immediate morbidity and mortality of COVID, then it's going to be the impact of a lack of resources, especially on those communities, that are poor and vulnerable. And then the impact of neglected chronic conditions. And then not to mention the psychological and family trauma, as well as the mental illness and the economic injury to already compromised communities. So we have to begin to think about our strategies moving forward by really identifying those key not-for-profits that are making an impact and that are improving the health of our communities, partnering with them strongly, leaning in that we don't lose this amazing collaboration that we have in addressing some of the challenges in our communities, that we galvanize those towards longer term solutions.
Yeah, it's just going to take everybody. It's going to take philanthropy. It's going to take healthcare, private sector, public sector, government, private individuals, business. And I think we've seen just, as you drive around, people are being housed right now. And it's a wonderful thing to see. So
absolutely,
hopefully we can keep that going. Tim, we lost you for a second. It looks like you're back on, and you were sharing something that you had read today. And I want to give you that opportunity to finish that.
Thanks. I think your question, I was trying to respond to a question about the future and what does the future hold for Providence in relationship to this issue. And I wanted to share that quote from the New York Times from this morning's op-ed, that the inequalities of wealth have become the inequalities of health. And I think that speaks volumes, talks to me at least about this magnification, this amplification of housing instability and homelessness as a social problem. I think it's important to call out the root causes. We can say that housing is health, but I think all of us, not just Providence, but well beyond Providence, we need to recognize and understand that housing is health. Housing is actually a health intervention. And when we talk about these root causes, we're really talking about decades of underinvestment in affordable housing stock. We're talking about wage inequality. We're talking about institutional racism. We're talking about an insufficient healthcare delivery system. That's not a knock on Providence, but it's a system that requires, obviously, insurance and allows for millions of folks to remain uninsured. We have insufficient resources to manage mental health and behavioral health challenges. We have insufficient resources to support transition from incarceration or foster care. There are so many challenges. This cannot solely be a healthcare endeavor. I think we socially, culturally, we need to revisit the question of commonwealth. What are we willing to tolerate in our communities? And what are we going to insist on saying never during my watch? What are we going to resist tolerating going forward? Because at some point in the next month or 2 months, when the crisis begins to abate, these hotels that are filled with what are now formerly homeless folks in a temporary fashion, someone's going to have to make a decision. Are we going to put them back out on the street?
Right. How will that be paid for? And
these temporary shelters,
yeah.
these trailers, are we going to put them back out there? And I think that in the end is going to be the measure of us, all of us, in response to this epidemic.
Yeah, it'll be a real challenge for us, and especially on the West Coast where we serve most of our patients and have such a high proliferation of unaffordable housing and homelessness. So a lot of issues. There will be plenty of work for all of us to do moving forward. Dora, you mentioned earlier our partners, and who are the partners? Who are the community partners? And we only have a couple minutes left, so just how do we get involved with different partners, and how do those relationships keep going together as we move forward?
Yeah, I mean, I hate to sound so cliche, but who aren't our partners, in this work?
Yeah.
No one, as you were mentioning earlier, Lori, no one gets off. But, we clearly have some really strong partners, in Catholic charities that are helping us with, some of our, collaboratives in Spokane, in Oregon, as well as in Northern California. We have a lot of the departments of public health, our not-for-profit organizations from around our system are so important. The not-for-profit organizations are often the backbone of serving our vulnerable communities. So, really knowing and identifying, having those strong relationships with some of our partners. But it's going to take, like you said, it's really going to take partnerships with our local governments, partnerships with our not-for-profit organizations, our faith communities. Some of the faith communities have just, due to a lack of, whether you have service or mass, that repurposing, some of their food banks and working together with them to really galvanize, community energy towards the future. And and just, I wanted to just mention just one quick thing in terms of, as we talk about the future and we talk about, perhaps people, just moving back into the street after being housed. But not only that, we have to make sure that doesn't happen, and that we can galvanize the energy and the political will for that not to happen, but also ensuring that we don't have more people that are losing housing. So many people are already living paycheck to paycheck, but that we're advocating for, eviction moratoriums in our communities to make sure that we don't further continue to amplify the problem. And we think about perhaps an increase in those that are experiencing charity care and enrolling into Medicaid, that, we really need to partner with our communities and know that this is really going to be the long haul, and that we're thinking about not only the immediate, but how do we address for what's to come and be prepared for that, and perhaps even find new partners that we hadn't had before to help us solve this crisis.
How can the common citizen that really doesn't know where to start, how can they get help us in this work?
Well, I know we have, the communities all around, that are 7 states, but really, reaching out we have a website, providence.org/housing-is-health, to be able to, if you want to find out information around what we're doing about housing instability and homelessness, but also, reaching out to I know that we have a lot of employees or caregivers that are listening to this today, but find out who your regional community health investment leader is, and really support some of the strategies that they have with their local communities. We have a volunteer program to help volunteer in our local not-for-profit organizations. So there's something that everyone can do. But most of all, check in, don't dismiss checking in on your neighbors and those that you perhaps go to church or mass with, that we need to be able to check on our own fellow employees as well as our neighbors.
Yeah, start local and then spread. Yeah,
absolutely.
Thank you guys so much. We quickly ran out of our 30-minute timetable as we talked early in the meeting. We said there's so many topics to get into. So thank you so much, Dora and Tim, for your time today. And to learn more about our initiatives, programs, and services, and ways you can support the programs we discussed today, please visit us on the web at providence.org. Your support is so essential to this work. Like Dora said, get involved. There's a lot of ways. Get involved with Providence. Get involved with your neighboring nonprofits. We're so grateful for your partnership with us. And if your question was not answered today, please don't worry. We'll be posting a blog later this week with some answers to the questions that we got. And please make sure to follow us on social media at Providence Health System on Facebook and Instagram, and under @Providence on Twitter. So thanks so much. Have a great rest of the day.
Thank you.
Thank you, Tim and Laurie.
Bye-bye.